Assalamu alaikum wa rahmatullah. Good morning, everyone. I am Layla Salhi, the Director of Virtual Healthcare Service Activation in Seha Virtual Hospital Ministry of Health. Thank you very much for the organizers for giving me this opportunity to share with you our experience implementing and adopting emerging technology in the Ministry of Health Saudi Arabia, and in particular Seha Virtual Hospital. First of all, we would like to give a briefing about the existing challenges that we have in the health sectors that affect the safety and the quality of the provided health service. The most common challenge, actually, the existence barrier or the geographical barriers that limit the patient access to get a specialized service. In addition to the shortage of having specialized healthcare providers in some of the medical specialties, and this is usually happen in the peripherals area. In addition to the increase in diseases rate in Saudi Arabia, treatment cost and delay in getting that treatment. Moreover, we believe that health justice and equity among members in the community is one of the major also challenges, in addition to the health security and avoid spreading of diseases. So in order to overcome these challenges, we need to start thinking out of the box and stopping thinking about and using the regular method and solutions. So we need to give more focus and investment in three main areas. Actually, the need for innovation and research. We need to start about more innovative idea to overcome these challenges. In addition to employing modern technology and artificial intelligence, in addition also to getting the advantage of the rich data that we have in the health sectors and how these data can give us more insight and the prediction as effective supporting tool to the decision maker. So in these three main areas, Ministry of Health in Saudi Arabia, they have launched and initiated number of initiatives, and one of them is Seha Virtual Hospital. Seha Virtual Hospital is a national specialized hospital linked and associated with healthcare facilities in Kingdom. It's implement innovative and emerging technology to provide healthcare services in timely manner. The main focus here is to provide service with high quality. So the main aims or objectives of Seha Virtual Hospital is to provide better health outcomes by providing easy access to specialized service, in addition to enhancing expertise of the healthcare practitioners by transferring and sharing the knowledge between the physicians or consultant in different places, in addition to reducing the cost of the provided care with high quality. So Seha Virtual Hospital has been launched in February 2022 by His Excellency Minister of Health, Engineer Al-Jalajil, and Minister of Communication and Information Technology, His Excellency Minister Sawaha, and His Excellency the Governor of Digital Saudi Authority, Engineer Al-Swayan. So the Seha Virtual Hospital has been launched officially, and it's considered the largest of its kind in the world, the first in the Middle East, and it's basically use modern technology and emerging technology to provide healthcare services. So mainly in Seha Virtual Hospital, we are using artificial intelligence, Internet of Things, telemedicine to provide a specialized service. The main focus is to fill the gaps in the peripheral hospitals that connected with Seha Virtual Hospital. So one of the biggest achievements that Seha Virtual Hospital got in November 22, it has been awarded the Digital Government Award for the best use of emerging technology in the field of digital transformation. After a number of evaluation and assessment, Alhamdulillah, Seha Virtual Hospital got this award as the first hospital who used emerging technology with achieving efficiency in saving cost and high quality. So basically, Seha Virtual Hospital provide 5 main categories of service: acute care virtual consultation that cover virtual critical care rounds, in addition to virtual stroke. Also, there are specialized virtual clinics. It's similar to the concept of outpatient clinics, but these provided remotely for the patient, or it's provided virtually. Moreover, there are the virtual committees or multidisciplinary committee. There are a number of committees like virtual cardiology board, virtual diabetes, virtual psychiatry board, and virtual tumor board. In addition, we have allied health service like virtual radiology and home-based care service, the remote monitoring for heart failure patients. So basically, in order to adopt or implement emerging technology and virtual services in particular, a framework has been adopted and applied in Seha Virtual Hospital. The framework contains a number of stages or phases in addition to work stream. So the first step will cover demand assessment and define needs. We need to identify exactly the gaps, the pain areas, the demand in the different regions in the kingdom. And this will be done by building a proper business case that exactly specify the need, exactly where is the pain that we have in this area, what is the high scope of the service, key stakeholders, and high and initial workflow or processes for the service. Once this is done, we need to conduct site assessment in order to check the site readiness in terms of clinical practices and also infrastructure readiness. Once all of this is done, we will go ahead with official engagement with the regions or site. Basically, we have it in Ministry of Health with terms clusters. So we will have official engagement with them. We will sign SLA. Then we will proceed by reviewing the market to find and select the proper technology that fill the need, that cover the business requirement, and this technology will be evaluated and reviewed from clinical perspective as well as from technical perspective. Once that technology has been selected, we will activate 4 or 5 work streams in parallel, starting with system implementation and integration. Then also we will work in the clinical governance. In this type of service, clinical governance work stream is crucial and very important to define the rules, responsibilities, and to avoid any medical legal aspect or things that may happen. So also here in the clinical governance, we will define the policy procedure for the service. In addition to this, we will work in a human resource and the staffing need. The recruitment process will be also initiated. And in addition, we will work in location preparation and location setup in the hub and in the connected hospital. And since we are talking about virtual care, it's considered like a new concept to deliver the health care Change management here is a crucial and very important. So change management processes need to be started from early stages in order to avoid any resistance from healthcare practitioners or from the patient side. So once all of this is done, we will have intensive testing iteration to ensure that the service that has been built applicable and doable, and it's running as per our planning. Once all of this is done, we will go ahead with the service with close monitoring, in addition to more optimization cycle, and also using the lesson learned to improve it through the service life cycle. So here we just want to share with you the challenges that we faced in this domain while implementing and adopting these emerging technology. Infrastructure readiness in a partner hospital is a major challenge, especially in terms of connectivity, system hardwares, and software. For example, like internet connectivity speed, network bandwidth, the availability of some of the systems like HISs. And in virtual care, since we are connected hub and centralized hospital with number of partner or peripheral hospitals, number of integration between system and devices need to be implemented in order to ensure full automated journey for the patient and healthcare practitioners, and to ensure manual work and mistakes that may happen, and also to ensure data integrity. So this is also a major challenge, since in each system or in each hospital there are different standards for system integration and for device integration. And as we mentioned here, it's about connecting centralized hub with number of peripheral hospitals. This part of communication need to be covered with a proper governance model to ensure the right authority escalations and communication between the different party involved in the service. Again, since we are talking about virtual care, which is a new concept, we face limited experience within virtual care practitioners or providers. Most of them, they need to work more in enhancing their knowledge and experience in this new method to provide the health care. Also, the rarity of international standard for virtual care is a major challenge. In addition to the virtual care regulation availability, it's also a major challenge. We have maybe like a general guidelines for virtual care and how to use telemedicine, but regulation for specific virtual care service, it's not yet available. Thank you very much, and more than welcome to have further discussion. Thank you.